I've been a doctor for 2 decades and my patients have taught me a huge amount. One of my key areas of interest now is reversing prediabetes and type 2 diabetes. Now, the fact that this is possible, reversing prediabetes and type 2 diabetes, is quite widely known now. Not everyone, not every GP or not every doctor is fully aware of the potential of this, but actually it's over the last few years it's become increasingly recognised as possible for most people. Now with my patients, I will often explore with them, if they're wanting to improve their condition, I'll explore with them why it's important to them. Why do you want to improve your health? Why do you want to reverse prediabetes or type 2 diabetes? And the reason we need to explore that is because it's the why, it's what we care about, it's what we think is important in our life and for our health that's actually going to motivate us to do something. So this is different for everyone. Some people it's about their pet or relatives or grandchildren or sibling or partner. Some people it's about a hobby they enjoy. Some people it's about wanting to live well for longer. Other people it's about wanting to function well today. Some people it's about wanting to reduce the medication they take. Everybody is different, but it's important to know your why. Why do you care about your health? Once we've discovered that, we'll look at their health, kind of what's the diagnosis they got, is it prediabetes or type 2 diabetes, and where would they like to be in the next 1 to 3 months. And again, this is really important because everybody is different. Not only are they starting from a different place, but their goals are different. Now, if somebody has prediabetes and they say, well, I'd like it to be significantly better in 3 months' time, we can then build a plan around that and base that on their lifestyle, the opportunities they have, and their own personal preferences. But some of the key areas we need to focus on, or often the key area we need to focus on, is nutrition. And the reason for this is the vast majority of patients I've seen with prediabetes or type 2 diabetes develop, and I'd be tempted to almost say potentially all or nearly all the patients I've seen that develop these conditions, it is nutrition that's playing one of the most important factors in them having developed it in the first place. And it is also known to be nutrition that can have the biggest impact on improving or reversing the condition. So what I'll initially do is explore what people have been eating currently. And people will often describe what they have for breakfast, and it's often cereal or porridge, sometimes some orange juice. And then people might be eating like a salad or a sandwich or something for lunch, and then an evening meal, which often combines some sort of protein like meat or fish or something with some potatoes. And then there's sometimes some snacks in between, such as biscuits. But obviously everybody's different, but that's a not uncommon description. Some people are immediately aware of what they need to do. They've recognised that they're putting sugar in their tea and coffee for years. They're having biscuits, and actually that needs to stop. Other people are surprised when they get the diagnosis of prediabetes or type 2 diabetes because they've not eaten sugar, or not eaten much sugar for many years, and are confused as to why this has developed. And invariably these people are typically eating either too much ultra-processed food, or just more commonly too much starchy carbohydrates, so the breakfast cereals, the pastas, potatoes, the rice, and the body just can't handle it anymore, and it's pushed the blood sugar up. So we then look at each of the meals and decide what we want to do with those meals and how they could reduce the amount of sugar, reduce the amount of refined carbohydrate, and what they would replace it with. Breakfast is often a key area that people struggle with because we're so used to eating toast or breakfast cereals. Again, everybody's different, but things such as omelettes are a much simpler option, or some yogurt, or some berries and some nuts, again, tailoring it to their personal preferences. Lunch, people, again, often find quite tricky because they've been used to grabbing something on the go or having a sandwich. In actual fact, it's quite easy often to find things. We tend to look for a protein-containing food, and is there some non-starchy vegetable or low-sugar fruit that they would enjoy, and bring those together. And then for larger meals, it's again quite simple, a bit of changing of habit, but it's often looking for foods that, again, we want to keep the starch intake lower. So the potatoes and the rice, pasta bases of dishes, that needs to be brought right down, or for some people they would just choose not to eat them at all. And getting some protein source, whether that's meat, fish, eggs, or tofu, or lentils or pulses, combined with then 1 or 2 veg, so green leafy veg is often good, or any vegetable that grows above the ground. And that combination will satisfy many people. For some people, they want to add a bit of fat to it, either some butter or some olive oil or something, which will just help their appetite. And certainly, if they're not wanting to lose weight, they can freely add fats like that without any trouble. People that want to lose weight, often keeping the protein up a bit higher, whilst not overdoing the fat, can be helpful. So relatively simple, but as you can hear, it actually needs a bit of personalisation. It needs to fit with where somebody is, what they want to achieve, what they're currently doing, and how they want to change and what their preferences are. But taking those relatively simple steps, we will generally see prediabetes or type 2 diabetes start to reverse within a few days. By a few weeks, the body's really transitioning, and blood tests 2 to 3 months in, you'll often see a significant improvement in blood sugar levels. Now, to reassure you, all this is backed up by the latest guidelines, which recommend reducing sugar and refined carbohydrate, and that reducing the total amount of carbohydrate in the diet has the most evidence for prediabetes and diabetes, and also it can fit with any other dietary preference.